Hi, my name is Maddie, and here at the School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Vaping and Adolescents, the New Public Health Crisis, presented by Allison Kilcoyne. This webinar will present the different types of electronic cigarettes products currently on the market, provide an overview of the medical complications, treatment modalities, and school interventions when working with adolescents with nicotine use disorder. Before we begin, if you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time in school. When health and education come together, great things happen. Attendance improves, conditions like asthma and diabetes are better managed. Behavioral health issues get quick expert attention, and we all know that healthy students make better learners. Now, we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. As you come up with questions throughout the presentation, please feel free to enter them in the chat box at the bottom of your screen. We will try to answer as many questions as we can following the presentation. Further, at the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 1 to 3 business days. Please also visit the School-Based Health Alliance website for additional archived webinars for topics such as the one you are viewing on your screen. Now I would like to introduce our presenter for today, Allison Kilcoyne. Allison is the Director of School-Based Health at North Shore Community Health and the President of the Massachusetts School-Based Health Alliance. She was a primary care provider that led an interdisciplinary medical and behavioral health care team at a high school and school-based health center in Lynn, Massachusetts. In her clinical practice, she was able to engage youth into the healthcare system and see firsthand the impact of school-based health centers on youth development. We are excited to have her as our presenter today on this webinar. Now I will hand it over to Allison.
Thank you. I'm going to push back to Maddie for 1 second with a technical issue with the slides.
Okay, yeah, we're starting you from the beginning.
Okay.
And now you have control.
Great. Great. So, thank you. I want to take a minute and just talk a little bit about the presentation. That we'll be reviewing some, but not all, of the brand name e-cigarette products, as there are so many on the market today. I chose specific products based on my clinical experience and what I see in my practice and my community. I'm aware that each community is different and you may see alternative products in your setting. Ultimately, the issue is the same. Vaping is a public health crisis. There's much jargon around today, as you may know, when it comes to the use of e-cigarettes. It changes frequently. If you work with youth and you pay attention, you'll hear new words all the time. These are just a few. E-cigarettes, vape pens, juuling, bow, blue, and usually the youth say that they rip it or they hit it. So you may hear other words being said. So what is vaping? When we look back into the development of the e-cigarette, interestingly, the premise was to help a long-term established public health problem, tobacco smoking. The thought was to create a way to deliver nicotine, the substance that's desired, in a less harmful way. if the thought was if you eliminated tobacco and the tar, figured another way to create the combustion of the nicotine, there would be less negative health effects. There's much that we can really learn from the research on tobacco, which we'll talk a little bit about today. So here, you know, all e-cigarettes have basically the same structure. There's a battery, and some are rechargeable batteries and some are not. There's an element in there that actually heats the solution of nicotine, a coil, usually made from some type of metal. A mouthpiece where the vapor is inhaled. And within the vapor are additives that may be harmful, and many that we may just not know yet. And here's a nice infographic that you can look at that looks at all the different types of electronic cigarettes on the market. Some look familiar. They're, you know, look like a pipe or a cigar. What I'm going to focus on today are really the medium, the tank devices, the rechargeable, and then the disposable cigarettes, because those are the ones that I've been seeing the most with the youth population. So the Juul, many of you have heard of the Juul. If you haven't, you will soon. This is the e-cigarette that really has exploded in popularity with our youth. It's rechargeable. There are pods that come in different flavors. You can plug it into your laptop. It looks like a flash drive. It's very easily concealable. There isn't a strong odor, especially with some of the flavors. And, you know, students can use this in many different areas, in the hallways, behind books, in the classroom. When you talk to youth about what they're using, it's helpful to understand how many pods they are using daily, as it gives you an estimate about how much nicotine they're using. Some will smoke all day long. So one pod is really equal to about 200 puffs, and that's one pack of cigarettes. Cost is another factor with the Juul. I've heard the starter kit comes with a device and 4 pods, usually retails for $40 to $50. Each pack of 4 pods is around $15. And then when demand rises and a lot of these devices and products are diverted, cost can really go through the roof. I've had youth pay $30 for a pack of 4 pods and $50 just for a device. So what I've seen is when students get caught in school and the device is taken away, often they're looking for a less expensive alternative, and either will switch to tobacco cigarettes or to some of the disposable e-cigarette. They're a little more economical, around $9 or so. That will last a few days depending on how often they're using it. They do have about 400 puffs, which is about 2 packs of cigarettes. I've seen people, so they say, oh, I use 1 disposable every 4 days, and that would be about 1/2 pack of cigarettes per day. So it is important to know that depending on the product is how much they're using it, they could be getting different amounts of nicotine. One does not necessarily equal the other. Then there are the medium tank devices that are most often used with THC or marijuana cannabis products. Pictured here are some higher end products, but just so you get the idea of what they look like. I'm not going to spend a lot of time today on THC vaping and focus more on nicotine. These types of devices you'll see with dabs or wax pen vaporizers. The cartridges here, though, are easily modified, and often you'll see people, if you're buying them either on the street, this is where they're modifying the little liquid to put vitamin E oil to make the illusion of a higher concentration of THC. So the use of the e-cigarette, you know, again, it produces an aerosol. The purpose is to combust the nicotine, that the nicotine, the vapor is inhaled. A lot of the particles are inhaled deeply into the lungs. A lot we don't know about what the long-term effects are. And the heavy metals that are seen that really are from heating, the thought is they're from heating of the coils, and the coils are degrading and being inhaled deep into the lungs. So I'm going to turn it over for a poll. Why do adolescents vape? Just to get an idea of what you're thinking. Use by a friend or family member, the taste, the flavors, believe there's low risk, less harm, curiosity, or all of the above. I know, you guys are smart. Yes, all of the above. But one thing I do want to talk about briefly is I'm going to try to advance here to the next slide. To the next slide, Maddie.
Yep, and if you have the poll question away, just push the exit out of it at the top.
Great. So to spend a moment to think about this whole thought of low risk and no harm. And so there's been a lot of research over the years. This data comes from 2016, which is a little bit older, but you know, 1 in 10 youth perceived intermittent cigarette smoking as little or no harm. And I think those of us that are practicing may have seen that, that there's this thought that I'm only inhaling water vapor and there isn't any harm. The other thoughts, I wanted to share some reasons why they started from students that I've worked with. I started at a party, then I bought my own, then I started using it every day within a month. You know, boyfriend gave me one for Christmas. Smelled good, so I tried it and I liked it. And my grandfather had one, I tried it, then I got one and I used it all the time. And this is very kind of typical. What you will see is there was a period of experimentation and trying it, and then youth getting their own and using them often. So how big is the problem? So this is a study many of you may have seen on monitoring the future from 2019, just released in the fall. So monitoring the future since 1975 has measured drug and alcohol use and related attitudes among adolescents and students nationwide. Students report their drug use behaviors across 3 time periods: lifetime, past year, and past month. This survey is funded by NIDA and administered by the University of Michigan. So what we know is vaping nearly doubled among high school seniors from 11% in 2017 to 20.9% in 2018. More than 1 in 10 8th graders say they vaped nicotine in the past year, and use is up significantly in virtually all vaping measures among 8th, 10th, and 12th graders. Reports of the past year marijuana vaping has also increased from 13.1% in 12th graders from 9.5% the prior year. And so when we think about what do students think that they're vaping, many just think they're vaping the flavoring. And what we know from studies from market products is that 99% of the cigarette liquid solutions have nicotine in them. So we're going to head into another poll just to get your thoughts, is why the increase in vaping in the youth? Peer pressure, increased access, increased advertising, or addictive properties.
Okay, we give it a few more seconds. We see the numbers still rolling. We have quite a few people on today, and we appreciate all of you for your patience and joining us.
I'm just looking. Interesting. I forced you to answer that question. As you may know, all of them may be correct. But if you close that out on your screen, and I will advance to my next screen, is what I wanted to focus on, just so you have an idea, is really the direct correlation between e-cigarette advertising and youth use. And so this CDC, and it is a little bit older, and from 2011 to 14, but as you see, as the dollars spent on e-cigarette advertising have increased, so has the past 30-day e-cigarette use among youth increased. And so, you know, some of us may be a little older and remember some of these, you know, Joe Camel and Wonder Woman with her Virginia Slims. And this was a very interesting slide deck I'd seen from Massachusetts Department of Public Health. And remembering that in 1970, you know, Congress banned airing ads like these for cigarette companies on radio and television. And what you see here are much more recent advertisements that have been on the internet, because the internet is not regulated by the FCC. And so it's using a lot of the same advertising techniques that have been shown to be successful in the past. Of note, I just to say, in the United Kingdom, where cigarette smoking is a huge problem, they do not see the same vaping crisis in adolescents that we do here, because there is a ban on advertising all cigarette and e-cigarette products. And so we're going to talk about nicotine. I did see a quick pop-up. It's like, yes, it is very important to talk about THC and cannabis vaping. I absolutely agree, and I think that in the future we should kind of delve into that. But today we're going to talk about nicotine as a substance. And so what we know about nicotine is it only takes 10 to 15, sometimes shorter, seconds to reach the brain. The effects last 30 minutes. It has stimulant properties, produces dopamine, serotonin. If you talk to youth, you hear them say, I get that bit of a buzz a bit when I'm using, hitting the vape, ripping the vape, excuse me. And it's highly addictive, more so than alcohol and cannabis, and actually properties are very similar in the brain to cocaine. And so what we know about the adolescent brain is it develops back to front. We know that that adolescents are pleasure seeking. You know, they are high reward seeking and have little regard for risks. And so so when you look here at where those centers are around the cocaine, heroin, and nicotine, for that in that pleasure center, you can understand how quickly someone can get addicted. So this is a small quote from the WHO about nicotine. Is a powerful drug that meets all established criteria for a drug that produces addiction, specifically dependence and withdrawal. Nicotine is as addictive as heroin or cocaine, has the paradoxical effects of being a stimulant and a depressant. No other drug does such high frequency. A pack-a-day smoker who smokes for 14 years will have more than 1 million dosing opportunities. And if you just think for a minute about a pack-a-day smoker and you put that over into the Juul, a pod a day, these kids that are starting in their early teens, and how many dosing opportunities they have. And then that onset of action being so quickly, 7 to 10 seconds, and then the half-life being 2 to 3 hours, and that really wanting to satisfy those brain receptors within that period of time. So the thing about Juul, you know, when you start to dive into why Juul, like why is this this such a thing? As e-cigarettes have been around for a long time, as we talked about the advertising, that plays a part. But if any of you have had a moment to really look at this Reuters investigative article, it looks at Juul and why it has been such a problem. They patented a formula that makes this nicotine salt that is a lot less irritating to the throat, and so that the inhalation can be much deeper, and increasing the amount of nicotine that can be absorbed. And so the developers of Juul, as you may know, they kind of came up with this proposal. They were Stanford, out of Stanford University, and they really dove into some of the tobacco data that looked at nicotine, and really looked at how do we develop it so people are getting more nicotine with less use. They focused on that first puff. Like if we can just focus on the first puff, will that hold that craving longer? And I will say that they say that the developers say they did not purposefully market to youth, and have developed a foundation to help youth not Juul and prevent it. And as you may know, some of the flavors have stopped being sold after October of 2019. But what we've seen kind of on the front lines is the fruits and the mints that are very popular with youth. And so one thing about vaping, marijuana, and THC that stuck out to me is that in states where marijuana is legal, about 30% of sales are on vaping products. And so, and as we know, in public health, federal regulations have really limited the research into the health effects of cannabis. And so messaging, I did see something pop up about, you know, we have to be careful about messaging in public health. We do, and I think that this is definitely evolving about how we talk about this stuff with youth. So I'm coming from it from a perspective with all youth that their brain is still developing, and so we don't know enough about marijuana and cannabis until, and that we want to protect their brain for as long as we can. And so I know you follow the news, and over the summer you saw about this vaping related sickness and all the reports of the illnesses that had been happening, and even deaths. And this kind of sparked public health to really look at what are the regulations, what are we doing about this. Just to know that it's not just the counterfeit THC vaping products that are linked to this lung illness. It was thought it's more of the, in the beginning we thought, oh, is it just the vitamin E oil and things that we're modifying to get a better high. But this e-cigarette vaping associated lung disease, the EVALI, you know, so some data here about they're mostly affected have been men and adolescent boys. We saw the emergency room visits spike in June of 2019, peaked in September, and then have dropped off a little bit. And then I found that this article in the New England Journal of Medicine that was put out by the National Syndromic Surveillance Program from January 1st, 2017 to December 7th, 2019, regarding emergency room visits in the United States, in which vaping products or e-cigarette use was determined as the reason for the visit, and it excluded injuries such as device explosions or accidental ingestion of the e-cigarette liquid. But in these numbers, related syndromes such as like acute intoxication from THC or nicotine poisoning were not excluded, just to keep that when you look at this table. But there are many reasons that might have contributed to the gradual increase in the incidence of e-cigarette use as a reason for a visit, emergency room visit. But especially when you look here, the patients from 10 to 19 years of age, you know, this is the summer of 2019, and we are looking at a doubling of vaping in the previous year. And so we don't know, but I found that this was a really interesting to look at, that the rise of ER visits has coincided with the increased use in youth. So we know there's a lot we don't know about vaping. We know a lot about nicotine and tobacco. We don't know a lot of the long-term health effects of vaping combustible nicotine. And so these are some things I pulled off of the FDA website. You know, there's been an association with mood disorders and poor impulse control. Could it, you know, harm brain development? Could it increase the risk of young people smoking cigarettes, or change brain chemistry that make people prone to other addictive properties? And there has been some possible seizures with overdosing. And so here we are. Vaping is bad, right? We know it's bad. It's not good for your health. Well, what are you going to do about it? Because anyone who works with youth know that if you tell them not to do it, then they're not going to do it. And so this is where all of our the great thing about school-based health is it's not just clinics, it's also public health, and we're in communities. And so I like to look at the three legs of the stool, right? Like, we want prevention, we want to delay use like anything we can. We want to create an environment where kids are aware of the harmful effects, so that they can make a choice to protect themselves, their health, and their brain. We want to develop treatment strategies, like both behavioral and pharmacologic. Remember, you know, nicotine is a very powerful drug that directly affects the brain. And so when we say you should stop, we need to provide the youth with the support so that they can stop. And, you know, we're going to look a little bit about restorative justice strategies for schools, and shifting our thoughts of consequence to thoughts of where are the opportunities. And, you know, there's always that fourth leg too, which is advocacy, right? So as in Massachusetts, what happened is there was just a moratorium put on all vaping products in September. The governor signed, like, we're just for 3 months, there's going to be nothing is available. And what that created was kids seeking help, which was great, but a real kind of bottleneck on how do we get them the care that we know that they need. And so looking at different avenues to provide both funding for these strategies, and education and training for the people that are on the front lines. So there are a lot of prevention campaigns out there. It's an easy Google search. I like the Ditch Jewel for the older adolescents. this is thetruth.com. They have great videos. They've got lots of merch. They had a big campaign where you could text to Ditch Juul and they would text you reminders of why you didn't want to vape. So we've kind of used that here at the health center I do my clinical work in. The Real Cost campaign, that's from HHS. It's, Make Smoking History, that's from the Department of Public Health in Massachusetts. And then for those of you that are kind of in a school setting, the Stanford Prevention Toolkit is a great opportunity for integrating into curriculum. And I'm just going to do a screenshot here. Everything you've ever wanted to know, the folks at Stanford have put into this tobacco prevention toolkit. I get a lot of, this is where I send the health teachers I work with. Everything is free and downloadable. So feel free to go on that website. It's very valuable. I just put this here also from message from the Surgeon General. It reminded me of like, this is your brain on drugs, but now here it is, we're talking about brains again and how nicotine cigarettes can harm brain development. So these posters are also available online for free at the surgeongeneral.gov. There's some other opportunities for technology and anti-vaping campaigns, again, prevention. The Adolescent Council and Technology for Nicotine and Tobacco in Possibilities for Change, that is the Jen Slano, who also does RAPS, if any of you who use that toolkit. She has a toolkit for nicotine and tobacco, and then another web-based video game intervention for younger adolescents, smokescreengame.org. So what do we see in youth that have been vaping? Just put your thinking caps on for a minute. So there's increased use, right? So sometimes these kids are in between classes. There's 7 periods a day in this school that I work at, and students will use a hit after every class. They're sometimes all day long. They are taking risks to get access to the vapes, right? Either they're meeting people to buy diverted ones. In Massachusetts, kids were all getting in the car to drive to New Hampshire to buy them. Each state has different regulations. So they're taking risks. They're bringing them to school where they know that they can get in trouble. They're hiding it from friends and family. A lot of my students sleep with it under the pillow so that they can use it right when they wake up in the morning. And so friends, and maybe they don't know. They're vaping alone. They're using it before they go to bed or in the middle of the night. And they're getting in trouble in school, at home. And so when we look at these things, what it reminds me of is the CRAFT screening tool. And so we're really looking at a nicotine dependence diagnosis, right? So we are looking at tolerance. They need more. Withdrawal. They have significant headaches, shaking, irritability when they stop. They crave it. They're taking it in larger amounts than expected. They've been unsuccessful in cutting down on their own. They're maybe not hanging around with the same friends anymore. And so for those of you that code, there is a nicotine dependence code, okay? They have a disorder that needs treatment. And so when we look at treatment, I know their youth, and behavioral interventions definitely need to be on the table, with education, peer support, provider support, some educational groups. But I think that we can't forget the pharmacologic needs, and that just stopping sometimes for some youth, it's not reasonable. They've been using a pod a day for a year or 2 years, and so decreasing on their own or stopping cold turkey, whereas it could happen, it may not. Some pharmacologic things we have to think about if you're a prescriber for nicotine replacement therapy is if they're under 18, it requires a prescription. Some health plans do not pay for the products. And so there needs to be either some financial incentive or support depending on a health plan. It's also considered off-label prescribing, for prescribers. If it's not indicated in under 18-year-olds, that is a risk that we think about. And that is just a very overview of treatment. And now just to talk a little bit about opportunities for restorative justice programs, specifically in schools. So how have they responded? I know myself that it has been, and it's been all over the news, that schools, they didn't know what to do. The kids were vaping all the time and getting caught. And so I've seen a lot of these interventions of searching all students, having every student empty their pockets when they kind of walk through the front door. I've seen taking doors off stalls in the bathroom, like, okay, maybe that will divert students from vaping in school. Locking the bathrooms, we had one in a school of 1,500, they locked all the bathrooms so the kids couldn't vape in the bathrooms, which became a different problem altogether. I've seen and heard of schools just saying, okay, there's no after school activities because, everybody got in trouble getting caught with the vapes. The newest thing I've seen a lot of is vaping detectors. And I always push back, what are you going to do if you find them? And that's the question. You can detect, but what are you going to do? And I've seen out of school suspension, not only just, in either an in-school suspension, but 5 days of an out-of-school suspension for vaping nicotine. So what restorative justice is, for those of you that may not know, is it's really looking at repairing the harm caused by the behavior. So if we're looking at what is the harm that is caused by vaping nicotine, even vaping marijuana in school and getting caught, the harm is really at the youth, right? They're harming their own health. And so changing the mindset with educators to look at it as an opportunity to intervene for the health of the youth, because that is where the harm is a process. It's not for the faint of heart, and there are some thoughts that we can maybe help people think about. So we talk about alternative to suspension programs, so what could they look like? And they could identify key people in the school that the student has to meet with, a school nurse, a resource officer, a health teacher. They could have students investigate health effects of vaping and create a project, a video, or a poster. They could have to go to their health center or their primary care for an educational appointment and come back with some proof of that. Or they could attend a multi-session educational group. And so one intervention that we did here was a vaping alternative program. We worked with our administrators here to a 4-session group with one intake at the health center. And so these sessions are led by school-based health center nurse practitioners. They are billed as group medical visits. We can do them individually or in groups. They're all offered follow-up nurse practitioner visits. They're all given some education on nicotine replacement therapy. We based the different sessions on the Stanford toolkit, looking at what would benefit students. And so we didn't agree on an alternative to suspension. Some referrals are in lieu of suspension, and some are part of a reduced consequence. So baby steps. We tried to institute something like this for marijuana 3 years ago, and it didn't work. But nicotine, people are willing to, the administrators here, at least that I've worked with, are willing to look at other programs. So I'm coming to the end, and we're going to leave a lot of time for questions, because I know there's lots of questions. But just some things that I thought about, what I want you to walk away with would be that vaping is very common in adolescents and been increasing dramatically in the past 2 years. That nicotine is highly addictive chemical that affects the adolescent brain immediately. There continue to be unknown health consequences of vaping, and it's very difficult to just stop, especially when there's been vaping for a substantial period of time, and that youth may need both behavioral and pharmacologic support.
Great, thank you, Allison. And thank you everyone for putting in your questions. Now is the time that we're going to answer them, and you can also put you can input more questions now. But before we answer them, we have a few announcements that we want to share with you. Please join us and become a member. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based healthcare. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit www.sbh4all.org/membership for more information and to join. The 2020 National School-Based Healthcare Convention will be held on June 23rd to 25th at the Sheraton Denver downtown in Denver, Colorado. Join the School-Based Health Alliance, the Colorado Association for School-Based Healthcare, and your peers from around the nation for 3 days of engaging workshops, networking, and fun. The theme for the meeting is School-Based Healthcare, Elevating a School Climate of Health and Safety. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. Registration will open mid-March, and we hope to see you there. Okay, and now we will get to some of your questions. Allison, there were a lot coming throughout the presentation, so I'm going to start with those. Someone asked, do you think that the new law that requires you to be 21 years old to purchase these products will help at all?
It's a really good question. I think anything that we can do to delay, even if it's a small section, to delay use of or access, I think is a good idea. I don't know. It is right now. There's a lot diverted, right? And so I do think that more regulations, kind of like years and years ago, changing the alcohol, the age to drink to 21, we saw a significant decrease in drunk driving accidents. So I think anything that we can do to protect that adolescent brain is a good thing.
Thank you. Someone else asks, what's the earliest age that children start vaping?
You know, I know that so the Monitoring the Future is 8th graders, and so I have seen that middle school age. I've actually clinically known students to start before the age of 12. You know, I don't have empiric data on what the incidence of that is, but I do know that the earlier that you start, the higher likelihood of having a lifelong problem.
Along the same lines, someone wanted to know if there are any vaping cessation programs for youth that are school-based.
And so I think no. I think that we here started one as a response to just kids not being able to have access and then having withdrawal symptoms in school, and the school not knowing what to do with all of these kids that were getting caught and suspended. So I shared the program that we did. I think that there isn't a standard, but I think any education would be helpful. But it's so, as school-based health is, everything is so dependent on the culture and the climate of your individual school. So I encourage people to talk to their administrators about what else to do to help the health of the kids.
Someone in the chat asked, can you share your vaping alternatives form for intervention within school-based health centers?
I think I can. I'd have to check about that. I will be at the convention, so I have to check about that. I don't see why I couldn't, but yeah.
Another question from the chat, any recommended curriculum for educating medical professionals?
I think, looking towards your Department of Public Health is a good place to start. I do know that in Massachusetts, the Department of Public Health has done a lot of work on doing some outreach and educating to healthcare professionals. So, and I hear things like, I see the chat box kind of popping up. So I think that there are things available on online, and there you go.
Someone else asked, what is the current recommendation for what to do with the actual vaping devices that are seized from students? We suspect some have THC, if not most.
So that's a really good question. I probably would put that to my individual people at the schools. I know that the ones at the school that I work to are confiscated by the school resource officer and then destroyed. Each school may have its different policies around if it's THC or marijuana versus nicotine. But I do know that they're usually confiscated and not returned to the family. So.
Another question from the chat says, I will assume that kids in sports who are caught vaping in school are in violation of the school athletic code. If that student athlete completes an alternative to suspension program, is their athletic suspension reduced and/or eliminated?
It's a really good question because we've had some athletes come through our program. So in Massachusetts, I know I'm speaking in my little world in Massachusetts, but it's all of sports participation and the chemical health is governed by the MIAA. It's the Massachusetts Interscholastic Athletic Association, and they have rules about if you violate the chemical health policy, which nicotine is part of chemical health, that you automatically lose 25% of your season. So in Massachusetts, there's nothing that can be done for that, but each individual school may have other things that they can that are more negotiable if the consequence is more harsh or worse than that. But a lot of it is governed not school-based, but with other associations. I do know, I'm pretty sure that in Massachusetts, at least, they're trying to develop some other protocols to roll out around the chemical health and policy and getting some support for these kids instead of it just being a consequence.
Earlier in the chat, a few people wanted to know your feedback on the Vape Educate program.
I am not really familiar with the Vape Educate program. I know a lot in Massachusetts with our Make Smoking History. I've used those programs often, and I clinically work with older adolescents in a high school, so I know that there are resources out there for younger kids, K through 5, that are working. The other thing I think that works really well is having some like positive youth development, youth engagement. We have a pretty strong community program here that engages youth on a different, not just about on a lot of different things, not just about chemicals. So the more, if you have a positive youth development kind of community support in your area, that may be a good place to go as well.
Someone else earlier also asked if are companies selling flavors like cotton candy with youth appealing packaging?
There are flavors that are still in the market, but in Massachusetts, they were banned. So in Massachusetts, the ban for flavors has still continued. But I do know that there there is access to different flavors. Now I know that Juul stopped producing their fruit flavors, but they still do produce the mint, which is very appealing. And so mint and menthol that are appealing to the kids. But that's, I'm not sure state versus federal regulations. I'd have to check on that.
Someone else asks, what are providers prescribing for minors who are vaping?
That is like a whole talk in itself, because nicotine replacement therapy is indicated in a lot of these the youth that have been vaping for a long time. And if they're vaping 1 pot a day, that's equal to 1 pack of cigarettes a day, and they're actually could be prescribed long-acting patches plus gum. And so that's what we're doing here. We actually have a nicotine replacement therapy program for kids going through our alternative to suspension. About 50% actually of the youth, I just was looking at the numbers, have actually agreed to go on some type of nicotine replacement therapy, either patches or lozenges or gum or both and so it is a new field. Not a lot of prescribers feel comfortable, but stay tuned. If you go to the convention, find me.
Someone else asks, what will it take to spark more discussion at the legislative levels on making vaping illegal nationally to our teens?
I don't know what it would take. I think it's continued education of people that are not possibly in the health field, like as to what the harms are and the reality of what's being inhaled, because I do hear that there's anecdotally that there's a lot of misinformation out there about risks versus benefits of vaping. I think that there will, as alcohol and other things that are available, like it could always be a problem. I do think that we missed this crisis. I think that we, as a public health community, it got sneaky and it just kind of exploded, and now we're backtracking, kind of like we did with cigarettes 20 years ago when I started becoming a nurse practitioner. So I don't know. I think continued education, I think continued research and people just talking about it and getting correct information.
Someone asked if you could revisit the pharmacological recommendations that you mentioned earlier and just provide more clarification and elaboration on that.
So if you go into QuitWorks online, if you Google QuitWorks, it's a quick guide to pharmacotherapy and tobacco treatment. That's where you're going to find nicotine replacement therapy recommendations. Mind you, and that's the Massachusetts Department of Public Health Tobacco Cessation and Prevention Program has a lot of infographics and quick guides for prescribers. I do want to say, though, that it is all off-label prescribing, right? So when you're prescribing to someone that's under the age of 18, nicotine replacement, you are doing so off the label of what the FDA recommends. And so, but if you go on the Massachusetts Department of Public Health Tobacco Cessation, you should be able to pull down the infographics, and I keep one right at my desk that talks about how do you titrate based on how much nicotine they're using, like how much you titrate. And sometimes with the youth, what I've found is that they don't believe it's going to work, and so that's in our school-based health center. We keep some of the lozenges, and I'll dispense one and stay with them and watch them, and then they realize, oh, I'm having a craving, I can take this. Actually, then I don't have the craving. So I think we're lucky in school-based that we have the ability to kind of stay and educate on that way. But I do really want to say, though, that it is off-label prescribing.
Another question is, should these kids be seen for mental health counseling or other resources to educate them on vaping?
I think, I'm a primary care provider, so I'm a family nurse practitioner, and I think a lot of what we do in primary care is motivational interviewing to help people change their behaviors. And I do think that for a lot of youth, this can be handled by a nurse practitioner in primary care. I do think that we also have to screen and make sure not more things are going on, especially if you get into the THC and marijuana, and if they are self-medicating or have some other things. So I think working in an integrated environment is great. Having some behavioral health people that can support you. I think that the availability is difficult. And I think that if primary care if we don't kind of take this on both from public health, primary care, there aren't enough behavioral health resources for the kids that have severe emotional disturbance. So kids that are vaping, I think we need to take this on as a public health, again, that 3-leg or even 4-leg stool.
Another person says, we have seen a high level of knowledge among students when we teach them about the harm of vapes.
Mm-hmm.
What can you recommend to engage teens who already know a lot but continue to use these products? Anything along the lines of social norm campaigns?
It's a really good, I do like that hashtag Ditch Juul program. I think that by the truth.com, I think that relates very well to adolescents. I think the thing with adolescents is that it's all in the messaging and in the relationship, right? So if they have a good relationship with a provider and we are educating them, realizing that we are not telling them what to do, but we are partnering with them to help them make a better decision and choice, it works over time. I think I had one girl who in October we started doing some education, and it wasn't until last week that she said, okay, now I'm ready, because I just don't want to have to buy these vapes anymore. I'm tired that I have to do this all the time. And so it's not a quick fix. We're not going to see it's really harmful for you, stop, and then they're going to stop. I think it's a process. And I think a lot of that has to do with adolescent communication, how we talk to teens. They are very knowledgeable, and it is very normal. Everybody's doing it, right? So it's a complicated thing, and it's definitely complicated to do in a 15-minute visit in a primary care office. So really good question, though.
Another question is, should we have programming to educate parents on how to detect or be watchful to deter their students from vaping?
Parents, there are great programs out there already, like In Plain Sight. That's a program where they bring in like how to look into an adolescent's room for things. When I talk to parents, I talk about just trying to have the conversations and look at what are the opportunities to have the conversations, and to have a clear message about substances in your family, and also to really exhibit the behavior you want to see in your youth, right? And so if you're vaping or you're smoking cigarette, your kids are more likely to do that. If you are coming home drunk, your kids are more likely to do that. If you are smoking marijuana, your kids are more likely to do that. So I think it's starting with exhibiting the behavior you want to see in your youth, and just looking for opportunities to have very brief discussions. Adolescent and parent interactions are difficult by nature, developmentally. They're supposed to be. And so I think it's sometimes finding another adult in their life that they could talk to as well.
All right, thank you so much, Allison. Unfortunately, that's all the time we have for questions, but thank you everyone for being so active in the chat box and submitting your questions. As a reminder, the slides and the recording of this webinar will be posted on the School-Based Health Alliance website, and we're also going to send a follow-up email with all the resources that were mentioned throughout the webinar and in the chat box, and we will follow up with you. So thanks again, Allison, and thanks everyone for joining us.
Thanks, everyone.
And before you go, we have a few evaluation poll questions. If you could answer them